Welcome. Today, we're diving into the topic of furcation involvement, a significant challenge in periodontal care. Furcation involvement refers to the pathological loss of bone in the area where the roots of multi-rooted teeth meet, most commonly due to periodontal disease. Understanding this condition is crucial for dental professionals, as it directly affects treatment planning and prognosis. In this video, we'll explore the anatomy, causes, clinical features, diagnosis, and management strategies for furcation involvement, ensuring you have a comprehensive grasp of this important subject. To understand furcation involvement, let's first review the key anatomical features. The root trunk is the undivided portion of the tooth root, located between the cemento-enamel junction, CEJ, and the point where the roots separate. The root cones are the divided portions that form the furcation region. The furcation itself is the area between the roots, while the furcation fornix refers to the roof of this space. Recognizing these structures is essential for accurate diagnosis and effective management of furcation lesions. Furcation involvement is defined as the pathological loss of bone in the furcation area of multi-rooted teeth. This process is primarily driven by periodontal disease, leading to the breakdown of supporting bone and tissue. As the disease progresses, the furcation area becomes increasingly compromised, making it more difficult to maintain oral hygiene and increasing the risk of tooth loss. Early identification and intervention are key to preserving tooth structure and function. The main cause of furcation involvement is bacterial plaque, which triggers chronic periodontal inflammation. However, several anatomical and developmental factors can contribute to the risk. These include a short root trunk, root concavities, the degree of root separation, cervical enamel projections, and accessory pulpal canals. Each of these factors can make the furcation area more susceptible to bacterial invasion and bone loss, emphasizing the importance of thorough oral hygiene and regular dental checkups. Furcation involvement is classified using Glickman's system, which helps guide diagnosis and treatment. Grade 1 represents an early lesion with slight bone loss. Grade 2 is a partial bone loss, often described as a cul-de-sac. Grade 3 is a through-and-through lesion, but still covered by gingiva. Finally, Grade 4 is a through-and-through lesion that is clinically visible due to gingival recession. Understanding these grades is essential for selecting the appropriate management strategy. Clinically, furcation involvement is most commonly observed in mandibular first molars. It is often associated with periodontal pockets, abscess formation, increased tooth mobility, and root caries. These features can complicate oral hygiene and make the affected teeth more vulnerable to further damage. Radiographs are used to confirm clinical findings, but probing remains the gold standard for detection. Recognizing these features early can significantly improve treatment outcomes. Accurate diagnosis of furcation involvement relies on both clinical and radiographic methods. The Neighbors probe is the instrument of choice for detecting furcation lesions, as it allows for precise probing of the furcation area. While radiographs can reveal bone loss, clinical probing is generally more reliable for assessing the extent and grade of involvement. Combining both approaches ensures a thorough evaluation and helps guide effective treatment planning. The prognosis for teeth with furcation involvement varies depending on several factors. Mandibular molars generally have a better prognosis due to their root divergence, which allows for easier access and cleaning. In contrast, maxillary molars and premolars often have a poorer prognosis because their anatomy makes access more difficult. Early intervention and consistent plaque control are critical for improving long-term outcomes. Traditional management of furcation involvement includes several non-surgical and surgical procedures. Scaling and root planing are the first steps, aiming to remove plaque and calculus from the tooth surface and root. Gingivectomy and curettage may be performed to reduce pocket depth, Odontoplasty and osteoplasty are surgical procedures that reshape the tooth and bone to improve access and facilitate cleaning. These therapies are often combined for optimal results. When traditional therapies are insufficient, surgical procedures may be necessary. These include root resection, hemisection, bicuspidization, and root separation. Each procedure is tailored to the specific anatomy and extent of the lesion. Root resection involves removing one root, while hemisection splits the tooth into two separate parts. Bicuspidization and root separation are used in cases where preserving tooth structure is possible. Surgical intervention is reserved for advanced cases with severe bone loss. Regenerative therapies aim to restore lost bone and supporting tissues in the furcation area. Bone grafts are commonly used to fill defects, while guided tissue regeneration, GTR, employs membranes to direct the growth of new bone and tissue. Alloplasts and allografts are alternative materials that can be used when autogenous bone is not available. These advanced therapies offer hope for improved outcomes, especially in cases where traditional methods are insufficient. Root resection is indicated in cases of severe furcation involvement, advanced bone loss, or untreatable root defects. This procedure is considered when other treatments have failed or are not feasible. The goal is to remove the affected root while preserving as much healthy tooth structure as possible. Careful case selection is essential to ensure the best possible outcome for the patient. Not all patients are suitable candidates for root resection. Contraindications include poor oral hygiene, systemic diseases that affect healing, fused roots, and untreatable endodontic conditions. In these cases, alternative treatment options should be considered to avoid complications and ensure patient safety. A thorough evaluation of the patient's overall health and dental status is necessary before proceeding with any surgical intervention. Early intervention and meticulous plaque control are critical for managing furcation involvement. Addressing the condition in its initial stages can prevent progression and improve the long-term prognosis of the affected teeth. Regular dental visits, patient education, and personalized oral hygiene instructions play a vital role in maintaining periodontal health and preventing recurrence. In summary, furcation involvement is a complex periodontal condition that requires careful diagnosis and a tailored management approach. By understanding the anatomy, etiology, clinical features, and available treatment options, dental professionals can significantly improve patient outcomes. Remember, early detection and consistent plaque control are the cornerstones of successful management. Thank you for joining us as we explored this important topic in periodontal care.